Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast. Nothing on the Bonnell Foundation Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Here's your host, Laura Bonnell.
So we are joined by attorney Beth Sufian, who graduated from the University of Texas School of Law, and you focused on health law and you represent people. You've written a couple of books and many articles, and we will also talk about, you were in a high-profile case most recently where you were brought to my attention through a number of people posting things. But first, we wanted to mention that not only are you an attorney, but you also happen to have cystic fibrosis yourself. So this is something that you live with every day, and you know it very well, obviously. Thanks for joining us.
Sure. Thanks for having me.
So why don't you tell me, first of all, when you were diagnosed and how things kind of rolled out after you were diagnosed with CF?
Sure. I guess you could say I had very classic CF symptoms. I coughed 24 hours a day. I had a lot of mucus in my lungs. It was green. I was extremely thin. I couldn't really eat much. My stomach, I had terrible stomach trouble. I had terrible sinus trouble. But this was when I was born, was 1965. And so for 9 years, I had sweat tests, but they never did them correctly, which was often what happened in those days. And so then when I was 9 years old, my sister, who was 7, was hospitalized for kidney trouble. And she was at a children's hospital. At the time, there were only 8 CF physicians in the United States. And one of them was in Houston, and he was doing rounds, and he said to the nurse, "Oh, you didn't tell me we had another child diagnosed with CF." And she said, "No, we don't have anyone newly diagnosed with CF." And he said, "Well, we will in a few minutes," because he saw my sister and heard her cough, and, he knew she had CF. So he did the sweat test himself and, of course, confirmed that she had CF. And then they went and got me and brought me in. And then finally, I had a confirmation of CF at 9 years old. There were no medicines, no treatments, nothing for us to do. And so we went home and kept coughing. And then at 16, people started doing treatments. So that was 7 years later. So that's the diagnosis story.
It really has come a very long way because now there are enzymes. You didn't even have enzymes then, correct?
No enzymes. No, ma'am.
So nothing to digest your food. What were your parents thinking? And are there just the two of you, or do you have more siblings?
There is a third sibling that's 12 years younger than me. And so she wasn't born at that time, but she does not have CF.
And it is very common, we found out, because we have 2 daughters with cystic fibrosis. It is more common than I thought that there are many siblings that have CF, either, for many different reasons. You didn't realize you were carriers, etc.
Right. I mean, when they had my sister, the third sister, they knew that we had CF, but that didn't bother them, or that wasn't a consideration for them.
So since you were diagnosed, and since everything that you have seen in relation just not only to medication, but also to insurance, medical insurance for people with CF. I mean, you used to be put in a big healthcare pool of insurance that was cost prohibitive for many people, correct?
If you had a CF diagnosis and you told the insurance company, you were not allowed to get the insurance. There was no way to get insurance unless you were on Medicaid, and my parents made too much money to get Medicaid. So we had insurance through my father's group, but we did not have coverage for CF. We weren't on any medicine, so that wasn't an issue. But there was no way to get insurance that would cover CF, and most companies that were selling individual plans would not sell a plan to someone who had cystic fibrosis.
So at what age were you able to get into a CF clinic and get some care and medication?
I was at a CF clinic right away at 9 years old. That was one of the only, there were 8 CF clinics in the United States, and one of them was in Houston. So I was seen at a CF center. There was just not any medicine for them to prescribe for me. Since I was diagnosed, I was at a CF center.
And how are you doing now? How is your health care, your medications, and your general health right now?
My health right now is very good. And I'm on a lot of medicine. So the medicine helps. I have a very good CF center and very good care. And I take very good care of myself, and my health is very good right now. I have had years where my health was very bad. In the mid 90s, I was hospitalized in 95 for 2 months at one time, and then many times after. 96, I was hospitalized for 90 days. In 97, I was hospitalized at one sitting for 102 days, plus many other hospital stays. So 95, 96, 97, if I was a wine, would not have been a good year to buy me. And then I was sick in 2012, pretty significant pulmonary infection, and I had a lot of trouble with Pseudomonas. But then, thankfully, I'm doing well right now. And I have not had a transplant.
And that's all fantastic news. And it's great because you can relate to everybody who is your client who has cystic fibrosis or a parent. And the reason that I found out about you was because of the Megan Willis case that was on the national news, and everybody was putting it in all of our cystic fibrosis Facebook groups. You represented a 22-year-old Megan Willis with cystic fibrosis. She qualified for Social Security benefits, and this also allowed her to have Medicaid, which paid for her health care costs, but then she lost it. It was last year, correct?
Correct.
And then she was not able to get back onto her Social Security benefits. They were canceled because someone said her health had improved, someone with the Social Security department, and the family couldn't afford private insurance. So after she called you, one of the things that I found out in reading the article and watching the episode that you did was that the review process takes 1.5 years, and who has 1.5 years, correct, to wait?
It can take that long. It depends on where you are in the process. So certainly it can take that long. If people come to us sooner, people know about us and come to us sooner when they're being reviewed by Social Security, we are very successful most of the time at keeping them on benefits. And that's, about a 2 to 3 month process. But once you do the initial review paperwork on your own, right now you have about a 95% chance of having your benefits terminated, because Social Security right now is trying to reduce their recipient rolls. And so they are scrutinizing a lot of people and terminating their benefits. So if you have your benefits terminated, it can take a while to get them back.
And how did they make, and anyone who's listening knows this is the CF cough that you have. And just,
yeah, sorry.
It's totally fine. It's just the way it is with CF. So, but anyone who doesn't know CF, that's what's going on. Who's making the decision that this person shouldn't have the health coverage?
If you're receiving Social Security disability benefits, you receive a check based on how much money you've paid into the Social Security system through work earnings, and you get Medicare 29 months after your date you stopped working. But with Megan, she had never worked, so she was receiving a benefit called SSI, which stands for Supplemental Security Income. That's for people who have not worked enough to get Social Security disability, but who are not able to work because of their medical condition. And if you get SSI, you also get Medicaid benefits. So if you're reviewed by Social Security, there's a Social Security worker who reviews your file, and they look at your medical records. If the medical records show that you have had minimal medical improvement, Social Security can stop the benefits and then your Medicaid stops as well.
Would you say that's pretty true across the country, or does it vary in each?
So Social Security is a federal program, so this applies across the country.
And do you think that people across the country, does everyone understand how it works? What do you find as you get each case?
So I think most people think if they're receiving benefits and they receive a review, that they just need to write, I still have CF and I can't work, and that their benefits will be continued. So I think a lot of people don't realize that under the Trump administration, there are many directives that are directing Social Security to reduce the number of people getting benefits. And I think still we have a lot of people with CF who do not know that and may not take the paperwork they receive telling them that their eligibility is being reviewed. They may not take it so seriously. So I run the CF Legal Information Hotline, which I've done for 20 years. And we've received 70,000 calls in 20 years. And then we run the CF Social Security Project, and we've helped over 4,000 people either get Social Security benefits or keep Social Security benefits. So I think there are a lot of people in the community that know about us, but I think there's also a lot of people that don't know about us. And there are a lot of CF centers that have had us speak at their education days over the past 20 years. We've spoken at over 100 different hospitals. So I think there's maybe 140 CF centers if you include satellites right now. And so a lot of those centers will refer people to us for help, and the help is free because the CF Foundation gives us the funding to help people for free, and there's no income cutoff for our help. But I think there's still some people that don't know about us and maybe don't really understand how important it is for them to get help on a review. So certainly anyone listening who gets a review should contact us ASAP.
Is it as simple as CF Hotline if they're looking for you online?
If you're looking for us online, we don't have a hotline website, so you can either call us at 1-800-622-0385, or you can email us at cflegal@sufianpassamano.com, which is kind of long, so maybe.
And we'll put it on our podcast information also. But
Right.
You also represent people in Michigan, about 70, is that correct?
I think we don't represent 70 people from Michigan right now, but I would say in the past 2 years, we've probably represented 70 people from Michigan, either in a review or an initial application for Social Security. So in addition to helping with reviews, we have funding to help people with an initial application for benefits. And we have a very, very high success rate. For every case we've taken for people that are actually eligible and don't go back to work or don't end up going over the income cutoffs for Social Security, we have won every case that we've taken. So similar to with reviews, there are some people who think you just go to Social Security, apply for benefits, and the next day get a check. And that is not what is happening. There are a list of criteria, medical criteria and non-medical criteria that people have to meet. And most of the time when we hear about people who've applied on their own, they do not even know what the criteria is, which means they don't know what evidence they have to show Social Security to become eligible for benefits.
What is the criteria?
It's a lot of different things. So for the medical criteria, for adults, it's an FEV1 below 50% every single PFT for the past year. Social Security only looks at the prior 12 months of records prior to applying. So a lot of times you have a 30-year-old applying who sends in records from when he was 15, showing that he was hospitalized, and that has no bearing on the case. So the medical records must be from the past year prior to applying. So if you apply today, they're going to look from February 2018 to now. You only need one of these criteria, so FEV1 below 50, every single PFT for the past year, If you're between 18 and 21, you can maybe have 55, 56, but it's pretty low PFTs. For children, it's a wide range of PFTs, but a lot of children, obviously, young children don't have PFTs. So typically, young children are not getting benefits based on PFT. The second criteria is 3 hospital stays for a pulmonary infection that has required IV antibiotics, 3 in the prior year, or 2 home IVs, 30 days apart, lasting at least 10 days, or CF-related diabetes plus a G-tube, or a G-tube plus 1 home IV, or diabetes plus a home IV. And the diabetes, you have to be using insulin for at least 90 days prior to applying. The other 4 are very severe, so oxygen at least 8 hours a day, or collapsed lung requiring hospital stay and chest tube for a certain number of days, or coughing up so much blood you have to have surgery for an embolization, or use of a BiPAP for a certain period of time because of very low oxygen saturation. So those are the criteria. Now, if you have 2 home IVs, you don't automatically get a check in 24 hours. Because you also have to show you have a lot of treatment time. So if you're just doing an albuterol puffer and that's it, it's going to be very hard to get benefits, even if you meet one of those criteria. So we always like people to know you have to be doing a nice amount of treatments, breathing treatments plus airway clearance. You cannot be smoking anything. If in your records it says you're smoking cigarettes or vaping or smoking marijuana, it's an automatic denial because you have a respiratory condition. And if you're smoking, Social Security says you are purposefully harming your lungs and you cannot get benefits. If you are illegally abusing drugs, you cannot get benefits. And if you are abusing alcohol, you cannot get benefits. So if you're doing any of those things, you then have to, if you're abusing drugs or alcohol, you need to go to a treatment program and you need to have a certificate of completion before you would be able to file for benefits. For the cigarettes or the marijuana, you need 2 clinic visits saying that you are no longer smoking. So those are kind of some additional roadblocks to some people getting benefits. But you also cannot be working more than 15 to 20 hours a week, and you cannot be making more than $1,220 before taxes are taken out of the work check per month.
How much financial help does someone get from that?
So if it's Social Security disability, that means you've worked at least 3 years and paid a certain amount into the Social Security system through work earning taxes. So if you've done that, it's going to depend on how much you've paid in. So if you're 22 and you've worked 3 years and you've made $10,000 a year, your benefit is going to be much less than someone who has worked 20 years making $100,000 a year. So the way to find out how much your benefit would be is to go to ssa.gov. So that stands for Social Security Administration.gov, like government. You set up a personal account, and then you can see how much your Social Security disability would be. If you have never worked, you cannot get Social Security disability based on your record. But if you have been deemed disabled by Social Security prior to 22 and after the age of 18, so between 18 and 22, then you can get a benefit based on a parent's work earnings only if the parent is deceased, disabled and receiving benefits themselves, or the parent is retired and receiving Social Security retirement benefits. So there are some people with CF who are deemed disabled prior to 22, and those people may be able to get a benefit based on their parent, but the parent must be either deceased, disabled, or retired and receiving Social Security benefits. If the parent is not one of those three things, the child cannot get a benefit based on the parent. Every week I have people call me and say, no, I can get a benefit based on my parent. I'm 32 and I'm just now applying for benefits. No, you cannot get a benefit based on the parent. So the parent has to be deceased, disabled, or retired. Very few people get benefits that way, but increasingly people with CF are, because as people with CF live longer, parents are either reaching retirement, being deceased themselves, or disabled. So that's sort of a very narrow way to get benefits for many people, but there are a nice amount of people with CF who get benefits that way. So the third program, the third way to get benefits is SSI. You have to be living in poverty. So if you have $90,000 in the bank, you are not living in poverty and you cannot get SSI. So SSI is for people who have never worked or not worked enough to get a Social Security disability check that is more than the SSI amount in the state. Most states right now are paying $770 a month. California and New York supplement with extra money. So if you live in California or New York, you get a little more, about $120 more in California and about $100 more in New York, give or take a few dollars. So if you live in New York and you move to Texas, you're going to have a lower SSI amount. SSI has the same work rules. You have to be working less than 15 to 20 hours a week, and you have to be making less than 1,220. But SSI will reduce what they pay you by work income. So if you make $2 from work, they reduce your check by $1. So for every $2 you make, SSI reduces the check by $1.
So you have to be very sick, and it sounds like very poor to get this.
For SSI.
For
right.
SSI, right.
For SSI. SSDI does not care. You can have $90 million in the bank. You can live in a mansion. Your spouse can be making $40 million a year. They do not care about anything for SSDI except how much are you working and how much are you making from work, the person with CF. So people get very mixed up between the programs, but the easiest way to remember is that Social Security disability only cares about how much you're working and how much you're making from work. They do not care about anything else. That's the easiest way to remember the differences.
And that got us to talking, we've talked about this before, then when you're thinking about a living will, what kind of a will should you get for your children? Because will it matter how much the parent leaves them or how much you're expecting to leave your child? And I was surprised by what you had said. So what are your thoughts on parents leaving living wills for their kids who have cystic fibrosis?
And I'm not sure what you mean by living will, but I guess you're just talking about
the special needs
for their children to inherit.
Yeah, we had talked about the special needs will. Trust. Mm-hmm.
Right. So that's not a will.
Okay.
So everyone gets very confused because, again, I'll tell you, about 90% of the people who call me, including doctors, including nurses, including attorneys, including people that work in financial offices and hospitals, act as if the two programs are the same. They interchange SSI with SSDI. They say Medicare, then they say, oh, I mean Medicaid, or they say Medicaid, and they mean Medicare. And it's really important for people to know what benefit they are receiving, because the rules about assets are entirely different depending on which benefit you're receiving. So my parents do not need to leave me an inheritance that would flow into a special needs trust, because I cannot get Medicaid. If I were to become unable to work, I have worked too much to get SSI, which means in Texas, I cannot get Medicaid. So I do not need my inheritance to go into a special needs trust so that money will not be counted so that I can get Medicaid, because I cannot get Medicaid. There's just no way, if I become disabled, I am not going to be able to get Medicaid because I have worked for 25 years and my Social Security disability check will be too high. So I don't want my parents leaving me money that will flow into a special needs trust, because I don't need to protect the money. It won't matter if I inherit a lot of money.
So
The only way it will matter is if the child with CF needs Medicaid or SSI at the time of the parent's death. Because if the parent dies and the child inherits $1 million and the child is on Medicaid or SSI, the child cannot have more than $2,000 in assets. If the child is married, they can have up to $3,000 in assets. So the only time you need a special needs trust is when you want the money to be protected so it is not counted for eligibility for Medicaid or SSI. So if the parent goes to a lawyer, we know this because this happens for years and years and years. The lawyer says, do you have a child with a disability? The parent says, yes. The lawyer says, you need to pay me $20,000 to set up a special needs trust, because if you die and your child inherits the money, the child will not be able to get Medicaid. So a lot of parents with CF set up either special needs trusts now or put in their will that if they die, all of the inheritance flows into a special needs trust. If the child really needs Medicaid, then that may be appropriate. If the child cannot get Medicaid because they've worked too much or they're married to someone who makes more than the federal poverty level, then the money goes into the special needs trust and it can never be taken out for housing or food. So I think, as we've discussed before, we have two clients. One had a mother who said, oh yeah, my daughter's disabled. I've got to have my inheritance flow into a special needs trust. The mother died. $1 million went into the special needs trust. The daughter is on Social Security disability and has Medicare. She does not need money in a special needs trust, but it's too late. The $1 million is in the special needs trust, and the daughter cannot take it out for food or housing. So the daughter has no money for housing, and she hires a lawyer to try to break the special needs trust because she says, this is ridiculous. I should be able to get the money out to buy a house because I don't have anywhere to live. I have no money for housing. The judge says you cannot break the special needs trust. Next case. So people need to be very careful about setting up wills that put the money on the death of the parent into a special needs trust if the child will not need Medicaid or SSI.
And that's because you said they have made too much money already as far as working, correct?
Either they've worked too much and they will not be able to get SSI, or they may be married and their spouse may have too much income to make, the adult child or the child, that the spouse could make over the Medicaid limit. So I got a call this morning, and last week I got one call about it. The week before I got a call about it. And I think people with CF and parents need to understand that Medicaid is for people that are living in poverty. It is not for people who need insurance. Saying you just need insurance will not get you Medicaid. You have to meet the low income household income So the whole household has to make money below a certain amount, and assets have to be low. There are a few states that let children under 18 get Medicaid, even if the parents' income and assets are over the allowable. But most states are doing away with those programs. Sometimes those are called a Medicaid waiver or a Katie Beckett waiver program. There are only a few states allowing those, and they are all now reevaluating the people who are receiving the waiver. And the requirement is supposed to be that if you didn't have Medicaid, the child would have to be institutionalized in a nursing home. And most people with CF don't meet that criteria. So a lot of people who are on Medicaid, who are under 18, but their parents' income is over the allowable, are losing Medicaid every day.
And it's a lot of information for parents. I mean, parents really have to keep reading and keep updated so they can teach their adult children how to start off. And also, we talked about this as well. In Michigan and in every state, they have something different, but children's special health care is not based on income as far as who can get it. But you also have to know if you move to a different state, like, for example, where you are in Texas, you may have children's special health care in Michigan, but if you move to Texas, you could be on a waiting list for what did you say?
You will be on a waiting list for 10 years. You will be.
Which is crazy.
If you move to Texas and you want children with special health care needs, you will be on a waiting list, and you will be on the waiting list for at least 10 years. So before you move, it's good to check into that. A lot of people move to Florida with CF because it's good weather and it's cheap standard of living, but they have very little services for people with CF, and they have no Medicaid for adults unless the adult is on SSI. New York or California, or one of the 37 states that expanded Medicaid under the Affordable Care Act to offer it to low-income adults, then you're very lucky. But if you move to one of the other 13 states, which includes Florida, Texas, Mississippi, Tennessee, those states, the only way you can get Medicaid if you're an adult, so over 18, is that you have to be on SSI. And if you've worked some and you are ineligible for SSI, then you cannot get Medicaid. So before you move to another state, if you have Medicaid in your state as a low-income adult, you should make sure where you're moving will allow you to have Medicaid based on being low income. One of the 13 states that did not expand Medicaid, you will not be able to get Medicaid unless you are getting SSI.
A lot to know. And if you have private insurance and you want to get children's special health care, you're not going to get it in Texas for a decade. So you will just have your co-pays to pay based on your private insurance.
Correct.
Okay. So you know so much because you're an attorney and you've been doing it for 25 years. But like you said, you get so many calls because people are confused based on different states and the state, the federal agencies. What's the biggest amount of confusion, I guess, that you get calls about?
There's lots of confusion. There's lots of confusion about Social Security. There's lots of confusion about working while you're on Social Security. There's lots of confusion about Medicare and what it covers and how you can help bridge the gap to Medicare copays. There's lots of confusion for people who move. There's lots of confusion about laws that protect students in school. And there's less confusion, but some confusion about working and the ability of the employer to terminate employment if you're sick and you cannot work. So I think there's confusion about that, although it's less.
And it does seem that the colleges, for the most part, are they abiding by the American with Disabilities Act, or is that the responsibility of the person with CF to make sure that it's happening to their advantage? And what should they do if they find that professors aren't paying attention to the fact that they have the ADA?
Yeah, it's really Section 504 of the Rehabilitation Act of 1973. That's the law that's going to get you modifications to policies and procedures that a college or an elementary or secondary school has. So it's rare that you would use the Americans with Disabilities Act for an education issue. Occasionally, but very rare, you would use the law that's been in effect since 1973, which is the Rehabilitation Act of 1973, Section 504.
But kids can use accommodations. I don't know, they call it that also. So if you're sick and you can miss an exam, you can make it up. They're pretty flexible.
I think some schools are flexible, some schools are not. Some Ivy League schools are very helpful, some are not. A lot of community colleges violate the law every day. We get a lot of calls about community colleges who just ignore the law, even though it's been the law since 1973. It just depends on the school, frankly. So when you're looking at schools, you should make sure that you talk to someone at the school who is a powerful high-up person, and you determine what they're going to do if you as a student get sick. Are they going to help you, or does it seem like they're not going to help you? If it seems they're really not going to help you, then it'd be good to find a school that actually would help you. So I don't think, I can't say, 95% of the schools help people with CF. I would say maybe 50% is probably closer. Schools don't like to accommodate people with disabilities, and they do not like to accommodate people with CF. They don't like when people are absent. They don't like to give tests on a different day when the test was offered. They don't like when people are absent for 2 weeks to do IVs. They don't like to give special accommodations with dorms. I'd say 50% of the people attending college have trouble with accommodations from a variety of schools, but I think community colleges seem to be the biggest violators. But again, we've helped people and given people information who are attending one of the top 10 Ivy League schools who don't want to accommodate the student. Now, of course, there are some that do, and sometimes it takes a lot of advocacy on behalf of the student and the parent. But at the very least, when you're looking at the school before you send in your deposit, you should talk to someone, a dean or president of the school if it's not a big school, but dean of students, and make sure that they are going to accommodate you if you get sick. A lot of kids with CF go to college and get sick.
Is
for
there
a variety of reasons?
Yeah. Is there an organization that rates universities or community colleges on how they do with the ADA?
Not that I know of. If there is, let me know, but not that I know of.
Yeah, I haven't heard of it either, but I just wondered.
I haven't heard of that. I mean, sometimes people go online and kind of say, has anyone gone to this school and did they give you any trouble if you got sick? But a lot of people with CF tell me, I'm not going to get sick. I'm not going to investigate that because I know I'm not going to get sick. And then about 4 months later, I'll get a call from the parent who's crying and the kid who's crying because they've gotten sick, but they never asked anybody about accommodations. They had no plan for what would happen if they were sick. And the school is saying, sorry, we're not going to do anything. So it's not a good time to explore all of this when you are getting sick, because obviously you're sick and you need to take care of yourself. But I think when you pretend that you can't get sick when you have CF, you make a big mistake. Right. I know people don't like to hear that, but that's what I will tell people who call. But, I think it's hard for people to think about when something bad might happen, but it's much better to think of that ahead of time.
We were very lucky with both universities, Michigan State University and Parsons, even though there were individual professors that sometimes didn't cooperate, then they got an advisor involved and they took care of it. But it's something you have to do every year. You have to reapply and give your diagnosis and stay on it every year and make sure it goes through and that it is listed so that all the professors can look at it. So yeah, that's a great point.
Right. And I would just say lately we have people saying, and I don't want to say because because it's where I went to school. Then someone can look that up. But even one of the places I went to school, they said to me, the school says it's optional for the professor to allow the student who with a disability to make up work.
Wow.
So that is 100% wrong. And it's not that it's a gray area of the law. It's 100% wrong.
Right.
The professor cannot decide that he or she does not want to follow federal law. So if somebody has a professor say, I'm opting out of the law, I tell people go to the president of the university. The professor cannot do that. And the law specifically says that policies and procedures should be modified for the student with a disability. And that's modifying when the test is taken if the student is sick. So I think that it seems like either a bunch of people went to some conference or something, because we've heard a lot about that in the past 12 months. Lots of people saying the professor says he's opting out of the law. You cannot opt out of federal law.
Right. And obviously that professor just doesn't have the knowledge, doesn't have the correct information.
I don't know. I think that it's an idea that they don't want to modify for a student.
Mm-hmm.
And if the student can't hack it according to them, then they shouldn't be in school. That's why we had the Rehabilitation Act, Section 504, because people a long time ago in 1973, but before that, with disabilities said, hey, we can't go to school. They won't let us go to school because we're in a wheelchair, because we have a hearing impairment, because we're blind. And that's not right. The federal government should say, if you have a disability, you cannot be excluded from school. And if you need modifications to policies and procedures, federal law should say that the school has to give you those. That was the impetus for Section 504.
Right. And very thankful for that law. That's for sure. And like I said, one of my daughters had to call the professor on it and actually say, here's the law. She went to an advisor who reminded the professor he did, in fact, have to follow the law. But it definitely does happen. Now, before we wrap it up, I wanted to ask you two things. First of all, I guess if you have advice for parents or anybody with CF, is there something, exercise or something that you do to try and keep yourself healthy?
Exercise? Is that what you're saying?
Well, whatever it is for you.
Are you asking me about it? The only time you're going to see me running is if there's a fire. So, like, I can't run. I have a lot of reactive airways disease, and I know there's a lot online about people running. I think it's great if you can run, but sometimes people call me and they're like panicked because they say, I can't run, but I know I'm supposed to run. So I can't run and I don't run. I do yoga. I walk my dog, which is like 4 times a day, and that seems to work. And I just started to do Pilates, which I kind of like because most of it is laying down, and that seems to be good for me. I try to exercise, and I know they want everybody to exercise, but I think some people have a hard time exercising. You shouldn't feel like you're a bad person if you can't run a marathon, because some people with CF can run marathons, but lots of people can't. And that doesn't mean that you're bad or you're not doing what you're supposed to do. So I've just tried to find, like, what exercise can I do without feeling like I'm going to pass out? And then I think walking the dog for me has been a constant for a very long time. And that, you have to do it because the dog has to go out. So that's a very good motivator.
That is great. And I do not have CF and I cannot run a marathon. So I hear you. I also wanted to ask you, you're married, right? And I know not everybody with CF can have kids, but do you have children, or can you tell us a little bit about that?
Sure. So I'm married. I've been married for 30 years. And actually my husband has been my law partner for about probably 20 years, I think. Is that right? Yeah, about 20 years. So we work together. And then in our firm, we have 5 other people that work for us. So we have a lot of people that work with us just to help people with CF around the country. So that's good. And then I adopted my daughter when she was a baby from China, 2001. And now she is 18 and applying or she's waiting to hear about her college from her colleges. That was a good choice for me. I never tried to get pregnant. I never wanted to be pregnant. I had a doctor during college who was terrific, and he just told me every so often, don't get pregnant. Don't get pregnant. It's not going to be good for your health. And that was good for me. Like, I know doctors wouldn't say that now, but that was good. And I had a good friend that I met who reinforced that. And she was the first person with CF to adopt a child from China. And I met her in California many, many years ago. And she said a very good thing, which was, you have to decide, do you want to be pregnant or do you want to be a mother? And if you want to be a mother, you shouldn't do anything that would make it possible for your health to decline on the way to becoming a mother. And so for me, that was very good advice, especially because my health, I had to spend a lot of time on my health, which I still have to do, but a little less now. So for me, the stress of a pregnancy, I think, would have killed me. And I thought, well, that's not going to really work out well because then I'm going to have a baby, but I'm going to be dead. So for me, that, which I know is not something to joke about, but true.
Right.
So for me, that was a really good decision. And I have an amazing daughter. She's last year when there was Hurricane Harvey in Houston, she started a nonprofit to help people with CF who were affected by the hurricane. And now she's expanding her organization to help people who don't have food with CF. So I feel like I won the jackpot of daughters, definitely. And I, was able to kind of keep my health steady, except for, a few years where Pseudomonas gave me trouble.
That is a beautiful description, the way your friend put it to you. I mean, that is beautiful. I think so many people are going to love to hear that, who are trying to make a decision on whether or not to have a child when they have CF or not.
And I think, it depends on your health. If your FEV1 is 100, you're on Kalydeco, you never cough, you're on no medicine. Right. That's a little different than except recently, I coughed all the time. So for me, that would not have been a good choice, and it worked out for me.
Fantastic. That's great. And I'm glad to hear about your daughter. She sounds wonderful. What legal advice, what is the best thing a CF parent can do maybe when their child's just diagnosed and you're trying to get them prepared for a life with CF? What kind of advice do you have to get them on the right road legally?
Legally? I mean, I don't know. Legally, a lot of times people don't need much initially, I think. I think the most important thing is just to teach the kids the importance of doing treatments, because we hear from a lot of teenagers and kids in their 20s, and they just don't take care of themselves at all. And so I think, instilling in your children the importance of doing your treatments and taking care of yourself, which I think even though we had no treatments, right. Our parents really instilled in us the importance of taking care of ourselves. And our parents didn't say, you can't do this, you can't do that. They just said, you always have to be taking care of yourself. You always have to be doing what's best for your health, because if you're not healthy, you don't have anything else. So to say, I don't have time to take care of myself, but then you're sick and then you can't do anything. I just think instill in people, it's good to do your treatments. And whenever I speak at CF centers, I do usually say, I think a lot of kids don't realize that there used to be kids who had no medicine, and they would have given anything to be able to do Pulmozyme, to be able to do Toby, to be able to take Kalydeco. Right. And so when I hear that people don't do their medicine, it's upsetting to me, because I knew those kids. I grew up with them, and then I went to their funerals. And to know that there are kids that are not doing their treatments and they have access to them, I feel like, kids should know you are lucky to be able to do this medicine. And instead of having it as a negative, we have to do Pulmozyme, to just make it a positive. How lucky we are that we have all these medicines, and let's do them, because that will help you. It won't mean you're never going to get sick, but it will reduce the likelihood of that happening.
You have made some wonderful points, and I'm sure just, people want to hear more from you, but I thank you so much for sharing your time and emotion and expertise. I mean, I've learned so much from you just in the couple times that I've talked to you. You are wonderful and delightful. And honestly, I could talk to you a little bit every day.
You're sweet. I appreciate it. I appreciate it. I have sort of, I'm 53. I have CF. I have some very, I'm pretty adamant on certain things. And I'm happy to talk. I'll give you, I think you'll post the email and the phone number. Mm-hmm. When you call, it's free and it's confidential. You can call as many times as you want. There's not a limit. And if we can help you with Social Security, we are very happy to help people. So feel free to call me with questions, and take care. Everybody take care. And thank you so much, Laura.
And thank you, Beth. And we're actually putting it on our website too, because the more I talk about you, I find that people either know who you are or they want your number right away, because I did send someone to you who was fired from their job. It's a young man in his 20s, and he believes it was because he was hospitalized for one of his exacerbations. So yes, people should definitely grab onto your number. We'll update it on our website, on our Facebook page, and also in this podcast. So Beth Sufian, thank you very much. And it's the CF Legal Hotline, correct?
Correct. CF Legal Information Hotline, correct.
All right. Thank you very much.
All right. Thank you. Bye-bye.
This has been the Living with Cystic Fibrosis podcast. Be sure to subscribe to the show in your favorite podcast app so you don't miss an episode. For more information and to learn more about the Bonnell Foundation, check us out online at thebonnellfoundation.org. That's the BONNELL Foundation.org. Or follow us on social at the Bonnell Foundation.